Hello, everybody. This is Gary. Today is May 1st, 2020. It is now 7:06 p.m. Eastern Standard Time in the United States, in Rochester, New York. And this is just a quick check in on my coping with my mental health and coronavirus and isolation. Um, I'm doing pretty well today. Today, which is the 1st of May, I got my Social Security disability check, which I use to pay all my bills, including my rent, electricity, heat, air conditioning during the summer, um, my telephone bill, my computer, internet bill. Um, so I'm doing pretty well. I have bills, but I also have money to pay them, unlike a lot of people in today's situation after losing their jobs and businesses because of the coronavirus epidemic or pandemic. But I'm doing okay mentally. A little bit of anxiety, a little bit of paranoia, a little bit of depression. I talked to my psychiatrist over the phone yesterday because of the coronavirus, COVID 19, social distancing. I do all my psychiatric visits over the telephone, including my primary care physician conferences over the telephone. Um, Interesting thing coming up is that my psychiatrist that I'm seeing right now is a resident, which means he's in training, and he's been with me for about 10 months now. And he will be leaving the clinic that I go to, I believe, in about 2 months, June or July. Today's May 1st. So I will be getting a new psychiatrist within the next 2 months, um, at the very latest. Um, this is always a difficult thing to do. You work with a psychiatrist who happens to be a resident, so they're not permanent. They're there for a specified period of time, in this case, 1 year, at a particular clinic as part of their psychiatric training, and then they move on to the next phase of their career, which usually means leaving the clinic that they were working at as part of their training. All of this is part of the University of Rochester, New York, um, in Strong Memorial Hospital. Strong Memorial Hospital is a teaching hospital where doctors, nurses, and other healthcare professionals train, and one of those uh, roles is to be a psychiatrist. And you are taught as you go along as a physician, as a nurse, as you go through the University of Rochester's training and teaching of healthcare professionals at the same time that you're giving care to patients. So I will be getting a new psychiatrist. I talked it over with the psychiatrist I have now. Instead of hooking me up with a resident, he's going to try to hook me up with a psychiatrist that's more permanently based in the clinic that I go to, someone who's already completed all the training and has many years of experience as psychiatrists, are no longer residents and haven't been a resident for decades. So they have a lot more experience, and I will probably work in with one of those more permanent psychiatrists who are not residents. Um, but this still isn't easy. You get used to somebody and then they leave, knowing full well from the moment you started working with them they would have to leave. Since I've been in Rochester, I think I've gone through four psychiatrists in the past 4 or 5 years. All of them are residents. I'm going to try to avoid getting a resident psychiatrist this time around. Um, it would be nice to have somebody who's a little bit more permanent and a little bit more in place as a psychiatrist. Um, I already mentioned that I went to the psychiatric emergency room um, over last weekend. Today's Friday, so it's been about a week since I was there. I went to the psychiatric emergency room last Sunday. They discharged me on Tuesday, and today is Friday, May 1st. So I'm just trying to cope with my paranoia, my anxiety, my fear, my worry. I have a lot of fears about a lot of different things. I worry about a lot of different things. Many of them are not even important. It's almost like I have OCD on top of my schizophrenia. Um, One of the things that always frightens me is if I go to the psychiatric emergency room or even the regular emergency room, that I might forget to turn off my stove or uh, make sure my space heater is disconnected and make sure that I didn't leave this oven on or some other random thing that I know I took care of, but I still worry about it anyways. Um, I don't know, it's weird. I have a tendency to worry about things that don't need to be worried about. And if you're wondering, today's a very sunny day out. It's about 12 minutes after 7 o'clock in the evening, and there's a sun. I'm sitting right in front of a window in my kitchen, and the sun is shining directly in on me as it starts to set. So I got this big light shining down on me, sort of make blinding me. I can barely see the screen. I can see the background of the screen, but I could see this lighted area much more easily. So the sun's going down. I decided to make this video at a time when the sun is very bright today, which I'm not complaining about. The good weather is returning to Rochester, New York. I mean, it was snowing as late as the last week of April last week. And I'm hoping the snowing is done for the rest of this season and summer and fall. Um, I don't like winter and I don't like snow. And I get out in order to exercise when the weather's more like it was today. Sunny, fairly warm, or at the very least only a little bit chilly. I went food shopping today, did some poetry writing, making this video, um, and a few other things, doing consumer surveys for extra money. So I'm hanging in there. Like, comment, share, subscribe, hit the notification bell, and share my videos on social networks.